Hello, everyone, and welcome to another Women in Surgery highlight video. I'm Katie Glasgow, a third-year medical student pursuing general surgery, and today I'll be speaking with Dr. Jessica Fazendin. She's an assistant professor in the Department of Endocrine Surgery. She's also the director of the medical student third-year surgery clerkship. So Dr. Fazendin, do you want to get started just telling us a little bit about yourself?
Well, first of all, Katie, thank you so much for having me on this. I feel honored to have been chosen because UAB has a very large group of just awesome women in surgery. And we're just all excited that people like you are choosing to pursue a surgical discipline because I think you're going to make a huge difference in the future. So thank you for having me. Just a little bit about myself. I'm a pretty simple person. I don't really know how I ended up here, but I'm happy that I did. I am a wife and a mother. My husband is also a surgeon. He's a colorectal surgeon. And I have an 8-month-old baby, Jordan, at home.
Congratulations.
And thank you. They are awesome. But during the day, I'm a surgeon. And so here at UAB, I think you alluded to this, I'm an endocrine surgeon. So I did 6 years of general surgery residency and then a year of research, and then an additional year of fellowship here at UAB in endocrine surgery. And I practice general surgery and endocrine surgery and do a lot of bits of education here at UAB and then also research. And so we're having a good time and learning as we go.
Yeah, well, thank you. Can you just describe your journey? You alluded to this a little bit, but how you got to endocrine surgery, maybe where you did some of your training, and then how you chose that as your final destination.
Yeah, so I probably have the same curse that many of you guys have during medical school, where it's kind of like you like a little bit of everything. And if that's the case, that you like a little bit of everything, it can lead to some confusion. So I worked as an anesthesia tech for 2.5 years during medical school, and I loved it. I had a blast and just really enjoyed the teams. But I always caught myself kind of looking over the drapes a little bit. My mentor kind of noticed it and just encouraged me to, just go full force into my surgery clerkship. And during that clerkship, I actually was able to rotate on endocrine surgery just by chance, and loved it. I also did trauma. I did acute care. And so I got a really broad view of surgery as a discipline, and knew that I was going to do general surgery because I still wanted to explore other subspecialties, and thought that would give me the best chance of kind of making a decision down the road. And then I never found anything that I liked more than endocrine surgery. So here I am.
Yeah, that's awesome. I think we've all experienced that at one point or another, like looking from the other side of the drapes and being like, oh, I want to know what they're doing on that side. Mm-hmm. All right. I guess our next question for you is, you talked about that you practice as both an endocrine and a general surgeon. So how did those practices differ, and kind of why did you choose to continue doing both?
Yeah, well, as many of you already realize or will realize very soon, I think life is about how you take opportunities and kind of how you can pursue things. And I was very lucky at the end of fellowship. I interviewed for a lot of jobs, and the jobs that I interviewed for were mostly endocrine only jobs, jobs that really made me focus on thyroid, parathyroid, and adrenal gland surgery. And this was really the only job, the one here at UAB, where I was going to still practice general surgery in addition to endocrine surgery. And so for me, I took it kind of as a challenge and something fun, because I spent so long training to be a general surgeon, and then had the icing on the cake was my endocrine surgery fellowship. But I think the general surgery part of my job is really great also, because those are bread and butter cases that I get to take students and residents through. And then to also serve our vets at the VA, which is really important to me. So I look at it as I get the best of both worlds.
Yeah, exactly. That sounds like a great way to kind of balance your practice. All right. Our next question is, what challenges have you faced as a female in the surgical field? And then just how have you overcome those?
Yeah, so when I knew you're going to be asking me about this question, I had to think a lot, because I'm the kind of person that probably steamrolls through things. And, if there's an obstacle, it's just about getting through and not really reflecting on it. But my husband, who I mentioned is a colorectal surgeon, he and I met in medical school, and then we couples matched. And we were 2 of 6 residents in the same class at the same program. And so it was really interesting to compare journeys of him and me in the same program. And I remember one instance where I was operating and it was a really tough case. And I was with the surgeon and we did something called an intraoperative cholangiogram to identify normal versus abnormal anatomy. And I looked at the images and I said, yep, that looks normal. I think we're safe to proceed. This is what I would do. And the operating surgeon kind of hemmed and hawed a little bit. And then my husband, who was my co-chief at the time, walked into the operating room saying, I'm going home. What do you want for dinner? I'll get it started. Good husband, right?
Yeah, great.
But he looks at the images and he says, oh, that's a normal intraoperative cholangiogram. You should just, keep going. And the surgeon was like, oh, okay. And just listened to my husband when I said the same thing 5 seconds before. And so that was, I think, honestly, even though it was my chief year, it was one of the first times where I felt like I was treated a little differently. And it didn't make me think less of the surgeon. It didn't make me think less or get mad at my husband. I was proud of him for having the same opinion. The right opinion is me. But I also just kind of knew, hey, it's up to me to be knowledgeable, to be skilled, and to be confident in my answers. And I can only control myself and what I bring to the table. And while I can't control everybody else, I can certainly, like I said, focus on me and what I'm capable of, and then help those around me so that the next generation doesn't have to kind of have those moments. And guess what? If I'm in the operating room and I'm doing an intraoperative cholangiogram and a female resident or a male resident says a really solid answer to me, I can support them and trust them because it doesn't matter what their gender is.
Yeah, I think you sound like you have a great outlook on those things of taking care of your own business and making sure that you're as well prepared as you can be.
Yeah.
Our next question is a little bit more about your personal life. So how have you managed having a life outside of surgery and family life and a social life?
Well, I'll be honest, I'm still figuring that out on a day-to-day basis as a new mom. And so I think one of the key take homes for me is find a place to work that really supports you and what your goals are, not only during the day, but at night, right? And, not only at work, but at home. And I think UAB and the leadership here in the Department of Surgery has been awesome. And it's organizations like the Women in Surgery here at UAB that does that. And so you kind of learn from other moms, other wives, other people that just have good balance in their lives. And so the way that I've chosen to look at it and kind of thinking about my life as a mother, a wife, and a surgeon is I'm just happy that I have the chance to do all three. And so I think that, choices are where the power lies. And so there's people that choose to not work and good for them. And there's people that choose to not have families and good for them. I'm just happy that I've gotten the chance to do all of it. And while I fail at everything at least once a week, when I'm at work, I focus on work, and it's all about communication, with my family to make sure that everyone's taken care of and that we're a team. And then when I'm at home, I really try to invest in them and to kind of leave work where it is and only kind of check back in if someone really, really needs me, like a patient emergency or a student that might need my help. But just like everything in life, you should be present wherever you are, whether it's at home or at work.
Yeah, that's some great advice. Speaking of advice, what advice would you give to female medical students who are exploring surgical specialties?
Ooh, where to start? I could, as you know me, I could probably talk for days on this, and it was probably going to take more than this interview to get it all out of me. And so this is my plug that if anyone is interested or watches this video, please email me and let me know that you want to talk about this. But I would say be bold. Just as, that instance where I talked about being in the operating room, maybe I didn't sound as confident as my husband did, right? And so I think as a woman going into anything, whether it's surgery or not, do the homework, do the work, show up prepared. And when you do, be confident in your answer and project strength. right? And that doesn't mean you have to be the loudest person in the room or put anyone else down. You can just have a quiet strength and inner strength, and be bold and ask for what you want.
Yeah. We'll end on a little bit of a different note. So tell us about something that you enjoy as a hobby outside of work, outside of the hospital.
Well, for people in my learning community, because I also am one of the lead mentors for the Kirkland learning community at the School of Medicine, we did one of the wellness days, and my activity was to go to the dog park because I have a cardigan Welsh Corgi named Argos who is obsessed with my daughter. And my husband would say he's also obsessed with me. But I love this dog. And so whenever I'm feeling stressed or just overwhelmed, I can take the husband, the baby, and the dog out for either a hike or to just go to the dog park.
Yeah, it's a whole family affair. I like that. Well, thank you for coming and talking with us today and sharing all your wisdom with the students. So thank you.
I wouldn't say it's wisdom. It's just maybe some collective experience. And Katie, you've got a career in many things, and interviewing is one of them.
Well, thank you.